House lays out House Bill 636. The chair lays out House Bill 636 by Wally and recognizes Representative Wally to explain the bill.
Good morning, Chairman Bell and Vice Chairs Wiener, members of the committee, this new committee, and I apologize, Representative or Chairman Bell, that I think you and Representative Spiller were the butt of some jokes last night, and apologize for that. And if you need interpretation, I can get you some interpretation on that from last night's.
We'll vote on it later.
Yes, sir. So House Bill, thank you. House Bill 636 directs the Texas Department of Housing and Community Affairs, known as TDHCA, to collaborate with the Texas Homeless Network, or THN, to implement and build a cohesive data sharing system to enhance the movement of data between agencies, service providers, and organizations. So in Texas, members, people are experiencing homelessness at a continuously growing rate, and it's increasingly challenging to track essential information needed to provide services within those agencies. Throughout 2024, a minimum of 62,000 Texans experience homelessness, and on any given night, between 27,000 to 30,000 people in our state are on the streets or in shelters. Among these Texans are nearly 6,500 of them are households with children, over 5,000 are chronically homeless, over 1,800 are veterans, and over 2,700 are victims of domestic violence. HB 636 seeks to foster a collaborative strategy to increase communication across people experiencing homelessness, housing, and health systems, which can benefit patients and clients' housing and health outcomes. Real-time data integration can be used to better coordinate efforts by locating participants using services in places like jails, hospitals, and the homeless system. The bill would direct, again, the TDHCA to collaborate with the Texas Homeless Network to create a homeless data sharing network through which homeless response systems and data warehouse vendors can share and assess real-time data on homelessness throughout the state. HB 636 will allow for more efficient and precise data sharing capabilities to serve homeless populations across the state better. Coordinating healthcare and homeless response systems can save the state and its partners time, effort, and resources. Currently, THN operates in 237 out of 254 counties and has had much success. Therefore, fully funding the network would help break down barriers to coordination between homeless response systems. We have a contingency rider, Mr. Chairman, in our Article 6, 7, and 8 in the budget for this bill. Should this committee pass it, it reach the floor and it get to the other side and be successful. Right now, that cost is about $288,000 per year in the upcoming biennium. Okay, and finally, the Homeless Data Sharing Network will be an essential tool as we move forward in tackling homelessness, and HB 636 seeks to expand this tool throughout the state. This bill is a refile from last session, and we passed it unanimously out of the House Urban Affairs Committee, and it made its way to the Senate and passed unanimously out of the Senate Local Government Committee. And unfortunately, we didn't get it over the line over there. But I think there's some momentum this session to get it done. And with that, Mr. Chairman, I would gladly answer any questions that the committee or you might have. And I know there might be some folks that want to testify on this bill as well. And would love the opportunity to close at the end.
Absolutely, thank you. Members, any questions for Representative Wally? Thank you. The chair will reserve your right to close.
Thank you.
We're going to begin public testimony. We have one person who wants to testify, Eric Samuels, testifying for the bill. The chair calls Eric Samuels, show you registered on behalf of Texas Homeless Network, and that you're testifying for the bill. Is that correct?
That's correct.
Okay.
All right, thank you, Chairman Bell, members of the committee. We definitely are in favor of this bill passing. This is beneficial in three primary ways.
Could I get you to go ahead and state your
Oh,
name and
yeah,
who you're
sorry.
representing and
Yeah, Eric Samuels, I represent Texas Homeless Network.
and your
And
position
I'm
for the
speaking
record?
in favor of the bill.
Thank you. Go ahead.
Okay.
Sorry.
Yeah, this is beneficial in three primary ways. First of all, the Texas Homeless Data Sharing Network provides the most comprehensive data ever collected on homelessness in Texas. The THDSN, and I know that's a mouthful, gives service providers, policymakers, and researchers a snapshot of homelessness on a state, regional, and community level at any point in time. We have relatively up-to-date information on the number of people experiencing homelessness, the demographic makeup, the details about subpopulations, such as veterans experiencing homelessness, and it also allows us to examine how communities are ending homelessness most effectively. One thing I want to point out is you have a data dashboard report. On that, it talks about just a little under 58,000 people experiencing homelessness. That differs from what the number the representative gave because we don't have every community on board. So that 62,000 includes that number that's not on board, but will soon be for this project. From a service delivery point of view, the data sharing network provides efficiencies to agencies and caseworkers delivering services to people experiencing homelessness. This is because the THDSN will help reduce duplication and increase coordination between programs and communities. Also, it benefits people experiencing homelessness because the information they have provided in one community regarding their history of homelessness and their needs can now travel with them between agencies and communities. A fully implemented THDSN will break down the silos that have historically created barriers hampering coordination between homeless response systems. And the third reason this is an important bill to pass is because the THDSN will provide data that will allow communities and the state to save money through greater coordination, especially by using the available data to reduce costly and frequent emergency room use and hospital admissions. This is a proven strategy in which cost savings are created by identifying frequent users of systems of care such as emergency rooms and targeting them for supportive housing. The focus results in more consistent health care and less reliance on emergency care. This creates better health outcomes for the individual and cuts costs to our communities while also allowing our managed care organizations to improve their social determinants of health outcomes. And I would point to the client success story handout that was also given to you. It profiles some of the early successes we've had working with Superior Health Plan on a data matching project. For these reasons, I feel this would be a value add to the state of Texas and our communities, and it would help us work with our communities to prevent and end homelessness. And I'll take any questions.
Thank you. Members, any questions for
I
Ms.
have a
Whitman?
question.
Representative Cole?
Well, you know, the city of Austin has a real challenge with the homeless issue. And we have, the state has a facility, Camp Esperanza.
Right.
That I think has been fairly successful and has had some actual city-state collaboration.
Exactly.
So I'd like you to tell me how this bill will help local entities with their homeless.
Right. So in this case, you could take Camp Esperanza, for example. If someone shows up to their doors needing help, if they have been helped in another community, Houston, Tyler, wherever, they could access the THDSN and access that person's file. So they could assess that person's needs faster and continue the care coordination plan that that person was on. It just would make things more efficient for the case managers working with that person. And it would prevent that person from having to go through this potentially upsetting story about how they fell into this position again, sometimes for multiple times.
Okay, thank you.
Any other questions? Representative Leo Wilson?
My husband and I worked with Cy-Fair Helping Hands for years, so he
great.
was on the
Thank you.
board there. But I felt like we did a pretty good job of that as a local entity in, identifying the services, because we divided it by a grid, so we saw the same people every single week. So just to build up a relationship and trust and get them whatever medical services. If they were a veteran, get them veteran services. So tell me, I guess I'm having a hard time understanding why this should be a role of government.
Why it shouldn't be a role of government?
Why it is, why,
Oh,
well, this
why
would
it's-
make
well,
it.
So you're talking about the community did a good job of reducing duplication and increasing efficiency.
I felt like
And
we
that's-
did.
And I'm sure you did. Outside of that community, when you're working with communities that are in a different geographic region, then you can bring that same kind of reduction in duplication and better efficiency
And
across the
do
region.
you have a fiscal note on it?
Well, yes, the
Well, I didn't see it.
representative
Okay. What
said
was
there
it?
was a contingency
Okay.
rider, yeah.
Okay, thank you.
Yeah.
And thank you for what you do.
Thank you. Thank you for your work at Sefer.
Other questions for the witness? You have, you have, okay. Is there anyone else? Thank you very
Thank
much for
you.
your testimony. Is there anyone else who wishes to testify on, for, or against the measure in front of us? If not, the chair recognizes Representative Wally to close on the measure.
Thank you, Chairman Bell. And so to answer the question, the bill on this, probably the third page, if you flip through it, there's the Legislative Budget Board provides us with fiscal notes to all our bills. And so the estimated two-year net impact to general revenue-related funds for the implementation of HB 636 as introduced would cost about $480,000. And that's a relatively nominal amount of dollars. And I think that as a member of the Appropriations Committee, I think I'll have a inside track if this bill passes on paying for the bill. It's not a lot of money, and it just streamlines the process so that you can share information within agencies. And you talked about the role of government in homelessness. I mean, I think it's just imperative when so many we're the safety net, but for this particular item, bless you, this network, these programs, it's not a state agency. They're named in the government code as the agency that this nonprofit that does a lot of this work. And so it technically it's not a state agency, but it's identified in the government code, and probably over 200 and some odd counties use this system. And so we're just trying to streamline the process for the caseworkers that are doing the day-to-day, meeting with clients, meeting with people on a daily basis to get them the services they need. And that's pretty much what it does. Thank you. And
Representative
Yes.
Rosenthal.
Thank you, Mr. Chairman. And thank you, Rep. Wally, for bringing
Thank you.
this. Quick question. So you're on appropriations.
Yes.
This total thing is less than $500,000? What's the total budget for the state?
it'll be about north of 330 billion.
Okay, so
With
what
the
we're
B.
talking about here doesn't even amount to a rounding error on our state budget. How many people are you hoping to help with this bill?
Say that again, Representative?
So the numbers, this doesn't even amount to a rounding error on the bill.
Oh,
$500,000.
Yes.
Not even a rounding error on our state budget.
That's
Not
correct.
Like we talk about budget dust, this isn't even dust. So.
It's a
how many-
speck.
How many people are you hoping to help with this bill?
Well, look, you.
What's your range?
Look, what the number, as I mentioned earlier, 58, 60, 62,000 actual people. That could be veterans, that could be families, domestic violence. But in this bill, we're trying to help them by helping the caseworkers.
Exactly. So we're
And
going to
it's-
be helping 50, 60,000 people with what amounts to budget dust.
That's correct.
Okay, so first, thank you for bringing this bill again. Hopefully, we can get it over the finish line this time.
Thank you. You guys have been great, and the House has been great on this. So, actually, look, the Senate's been great as well. We're just getting a little bit more push on the other side too.
So, any other questions? So, okay. Garcia Hernandez.
Thank you, Chairman. What are some of the resources these entities would share and use to build a homelessness system?
Well, a lot of times what you'll see is, in kind of discussing with the caseworkers is some of them may be on Medicaid. So when you look at the actual language of the bill, two things are important. Because we're trying to get information from, in working with the health benefit plans, right? So the end user could be on Medicaid, right? Part of that system is being able to, if you're in Austin or if you're in Houston, is to be able to, in this system, is to share in working with the MCOs, because the MCOs obviously have a vested interest in making sure that that person is getting the care they need. But sometimes there's a breakdown between when somebody maybe moves from Lubbock to Austin, or Dallas to Austin, or East Texas to Austin, or vice versa. I mean, there's a transient community, right? And so that's really at the healthcare component. I think that's where we, if in my opinion, that's why the MCO, you work with the MCOs, who then can work with the caseworkers and share the information amongst themselves. One of the other thing I think that's key in the bill is confidentiality, right? So on the first page of the bill, Section C, the department shall ensure that information shared through the Homeless Data Sharing Network that it is confidential under state or federal law. So that's an important component. It might be a little boring component, but it's important so that should this bill pass, you can share the information amongst each other, whether it's the MCO, the agency itself that's providing the care, or the caseworker, and not divulging people's information. Privacy is very important, right? You want to maintain that privacy in that client's being, right? So I think that's important. I think that's kind of the gist of the bill, is being able to work with these MCOs and get them the care. Because then, look, you get them the care, then they can get mental health treatment, they can get substance abuse treatment, they maybe reunite with their family, or I think that's important. Just because you have so many people in this state that are suffering from mental health issues, we need to get them the care they need, and the services are there.
I'm glad you brought that up. We've got a really great provider in our district, Metro Crest Services. One of the things that they talked about was needing the ease of being able to share information regarding mental health access to services, even just within the North Texas area, but because of the fact of, HIPAA and providing that information, and just like you said, very often transient, so we've got people moving around in the DFW area.
Right.
Would this be a step in that direction of being able to create that interconnectivity?
Absolutely, Representative Garcia Hernandez, and so that's really what we're trying to do, is just streamline that process amongst the agencies themselves.
That's great. Thank you so much for bringing a bill like this. I think this is a right step in the
Thank you.
right direction. Thank you. Thank you, Chairman.
Thank you.
So, sorry.
Well, I just wanted to make sure I understand it well. What I kind of see in the bill is the opportunity to create a hub where all the resources that are available to the homeless are identified, and it can help link all of those, so we have better access, better utilization of the resources that we have available in the state. And that seems like $487,000 fiscal note for 2 years is that access to resources that otherwise may not be available to identify the things you said seems to be well taken. So
Yeah, no, thank you. I appreciate that assist, Chairman Bell, and that's exactly why the bill is important. There's a lot of great agencies around the state that are doing good work. We're just trying to get them talking to each other.
Well, thank you, Representative Wally. Seeing no other questions, House Bill 636 will be left pending at this time.
Thank you.
Thank you. The chair lays out House Bill 223, calls on the author, Chairman Capriglione, to lay out the committee substitute to House Bill 223. Explain
Great.
the bill.
Thank you. Good morning, Mr. Chairman, members.